When I was a first-year PT, had a patient who had a TKA about a year earlier. This guy was a Mennonite dairy farmer who was 6'3" and all muscle. I cannot emphasize enough how solid this guy was. A total man. He had a 90-degree contracture and refused the surgeon's request for a manipulation because he didn't want to pay for the anesthesia. Asked if I could do it. I responded, "Yeah, I could, but there's a reason they put you under for this because it is torture." He proceeded to demand it. Told him that I'd do it next session and to prep accordingly, ride home, etc. He comes in his leather brown Chuck Taylors and cowboy hat, ready to get down to business. We go into a private room with a PTA and an intern. We lays down and I repeat my warnings of intense pain, and he pulls his leather belt from his jeans in one pull, puts it in his mouth, bites down and grunts, "Do the damn thing!" We push. Knee sounds like a shotgun going off, and he starts screaming, "I see spots!" We move his knee through the range of motion a few times, and I tell him to stand up. He puts weight on it, and I tell him to carefully squat on it. He squats all the way to the floor 5 times without issue. Immediately, we all begin to hug and high-five and leave the room to a silent clinic. Full clinic, but all looking on because it sounded like someone shot a bear. The guy comes in 1 week later, all smiles, and brings me a gallon of the best cheese curds I've ever had. He's still doing great.